afternoon. I hope you had a good lunch, and I'm glad that my presentation is only 10 minutes, because afterwards there will be a silence in the room. So I'm going to be presenting on a case we received from an underground miner. It's on barotrauma, which is a trauma from air pressure difference experienced by an underground miner. So this worker came to OHCOW to get an opinion on if his condition in air, which was rupture in his eardrum and other air problems like vertigo, bringing in the air, loss of balance, sensation of fullness in his middle ear, and painful feelings. So he came to OHCOW to get an opinion if his health conditions and his diagnosis was work-related or not. So before we look into the case, I want to give you a little bit of background of his conditions. While working as a shaftman, he was working in an underground cage. It's an underground elevator, and he was on top of the cage inspecting the shaft of the elevator. So one day when he was descending, he felt sharp pain in his right ear. Then he went to the doctor and found out that his right eardrum tympanic membrane was ruptured. He was assigned a different job on surface for a while. Then after a couple of months, he was sent back to the same job, but this time he was in the cage, in the elevator, performing the same type of work, descending and ascending, offloading stuff at different levels of the mine. So one day he was descending, so all of a sudden he felt sharp pain in his left ear. He went to a doctor and found out that he got an injury again in his left ear. Audiograms were also done after his first injury in 2012. And there were several other audiograms afterwards, and they all showed hearing loss in his right ear and some hearing loss in his left ear. He filed a compensation claim, which was not allowed. He didn't file the claim after the first incident in 2012. He filed the claim after the second incident when he got sharp pain in his left ear. It looks quite simple when you look at the biology and apply a little bit of common sense that certain high pressure on the eardrum can rupture the eardrum. But still, the claim was denied because they don't look compensation claims in general sense. They look compensation claims on its own merits. So the case was denied, and the worker was probably wondering where to go from here. He knew that his condition was, of course, work-related, but his claim is denied now. So where does he go? He has already seen ear specialists who concluded that this condition is probably work-related, but now he was looking for an avenue to go and find out an expert opinion about his condition. So he came across OHCOW. He came to OHCOW, and this is where OHCOW is different from other health and safety organizations, because when we receive a claim, a case or a claim, we look at claim from different angles, from medical perspective, from occupational hygiene perspective. If it is MSD, we look at from ergonomics standpoint, and we also have occupational nurses to look at the medical records. So we have a team of medical doctors, occupational hygienists, ergonomists, and administrative staff who look and review these cases. So this worker came because of this particular reason, I believe, he came to OHCOW to get an expert opinion from the occupational hygienist and the doctor and the nurse. So this is just a schematic diagram of an internal ear, just to give you an idea about what I'm talking about. So in case of barotrauma, there's a natural mechanism in our ear which balances out the external and internal air, and sort of prevent the eardrum from rupturing. So if there's a high pressure outside in the external canal, the eustachian tubes, which are connected in the middle ear and at the back of the nasopharynx, opens and allow more air in the middle ear and increase the pressure and then balance out the pressure on the tympanic membrane. But for some reason, if the eustachian tubes are dysfunctional and not working properly, then this mechanism fails and the pressure from outside or in the atmosphere exerts pressure on the eardrum, and eventually eardrum gets ruptured or perforated. This is a diagram of a ruptured eardrum. So a little bit on the work history of this worker. As a shaftman, what he used to do was his main job duty was to inspect the shaft in the mine. So he used to get on top of the cage, the elevator, and the shaft used to move up and down at a very slow speed so he can inspect the elevator mechanism and the integrity of the shaft. And his first injury took place when he was descending at a very slow speed of 60 feet per minute, which is equal to 1 kilometers per hour, sort of dead speed. And it's interesting to note that his injury, one would think that it has to be very high speed of descent when this injury can take place, but when he was moving at a very slow speed, this injury took place. He felt sharp pain in his right ear. He went to the doctor and found out that his right ear was ruptured. As I already told you that he went under some modified work duties on surface, but after a couple of months he went back to the cage as a cage tender. But this time he's inside the cage, inside the elevator, and his main job duty was to offload different mining stuff and machineries at different levels, and also offload miners. The cage was about 5 foot wide and 10 feet high, and he used to make 10 to 16 trips to the depth of 5,000 feet at a speed of 2,150 feet per minute, which is equals to 40 kilometers an hour, which is quite a high speed of descent and ascent. So in total, in 7.5 shifts, he used to make 165 trips at this speed, which is equal to almost an year of trips of an underground miner. So he was not only exposed to the rapid air pressure difference, but there was also a repetition of the barotrauma exposure. So during one of the descents, he again felt sharp pain in his left ear, and then he stopped work, went to the doctor, and this time he found out that his eardrum is damaged, not to the point where it is ruptured, but it was swollen. So what OHCOW did in this case, the case was self-referred. The worker came to OHCOW. He knew about OHCOW from our outreach to the unions, and this is also shows how closely we work with the unions and the workers. He was interviewed by the occupational hygienist, myself, for getting information about his workplace, the dimensions of the cage, and to obtain details about the pressure differences underground and on the surface, and also to get details about the work history. Then he was also being examined by our occupational medicine doctor, Dr. Ron House, and he also looked at his audiograms and looked at his medical history and medical documentations. We also did some literature search to see if there has been any peer-reviewed articles on the same situation from where we can learn and draw some conclusions. But unfortunately, there's not much literature on this type of not this type of hazard, but this type of injury in this particular type of work. There has been some literature on barotrauma, but mostly it is associated with underwater deep diving or in airplane flight crews, but not much on underground miners. We came across this interesting study because we were wondering what's the pressure difference when one goes down in an underground mine. We couldn't get any data from the company on the pressure difference because nobody has ever looked at it. But we came across this interesting paper which shows that if one goes down to a level of 5,000 meters, 16,000 feet, these mines are ultra deep mines. So when one goes to this level, the pressure difference increases 66% as compared to atmospheric pressure. But the study is at the same time is concluding that the descent at this level would not cause any harm provided a person has good dental care, healthy sinuses, unobstructed ear canals, and normally functioning eustachian tubes. But there's no commentary on this in this paper about the repetition and the speed of descent and ascent. There's no commentary, so we still don't know if the repetition or the high speed of descent would have caused the trauma. So Mayo Clinic also has some information about eustachian tube, which shows that pressure difference can cause trauma to the eardrum. And then there's another paper which is of interest in regards to this case shows that repetition of exposure to pressure variation can cause permanent hearing loss, chronic tinnitus, and damage to inner ear and eustachian tubes. So we came across at least one paper which shows that the injury of this worker could have been because of the barotrauma. But there was not a tons of different papers on this topic. We also came across two tribunal decisions from the same type of work, but these workers had pre-eustachian tubes dysfunction. So these two cases were allowed based on that the barotrauma aggravated the air conditions, but still there's an example or there's a precedent that barotrauma can cause eustachian tubes dysfunction. So these two decisions are slightly different than this worker's condition, but still it has some relevance. These workers in these two, so I need to see it up, okay. So almost done. So these two workers were underground miners. They were not working in as a cage tender or shaftman. So they were going in the mine once per shift. But still they had eustachian tube dysfunction because of their predisposition to this dysfunction. So our finding was that this worker's eardrum rupture and eustachian tube dysfunction and subsequent hearing loss and other complications were from the barotrauma and from because of the repetition and the high speed of descent, which is in a way quite in line with the paper I just mentioned, which has shown that repetition of barotrauma can cause eardrum rupture. Further to that, we did get in contact with the worker as a follow-up to find out what happened after he filed the claim based on OHCOW's expert opinion. The claim was allowed, but this worker is still experiencing other symptoms like ringing in the ears. He still have problems with his balance, so he's sort of he's suffering from a disability from this injury. And his co-workers are still performing his job, and some of them are showing the similar symptoms. And on prevention front, first of all, the injury is not very well recognized by the company. So what to talk about the prevention? Because it's not, we don't have any, first of all, we don't have any study on the prevalence of this type of injury in minors. And this is something which is not commonly seen among minors, but we have seen cases, and this is one of the cases. So this is a hazard, but not widely recognized as being a hazard. So on prevention side, there is a lot to be done, I think, because first of all, it is not recognized. First of all, it needs to be recognized, and then somebody can come up with some prevention strategies. So what we think is more research should be done in this in this direction, because we need to know. It's always good to know that these hazards can cause what type of health problems. And once a study is published, it has validation. Now other people can also draw conclusions from the same study and use the study in different manners. So I think OHCOW thinks that there needs to be research done in this category on what's the prevalence of this type of injury among minors, and if the change in barotrauma can cause this type of injury or not. We believe that it can cause injury, but now we're looking at each case on its merit. But once somebody will have a study published, then people can draw a conclusion on it on general basis. And also, we need to come up with the strategies on prevention side as to, and I'm just thinking out loud, can somebody do medical screening to see if minors has no predisposition to eustachian tube dysfunction? Like one can screen for any blockade in the ear canal or any infection in the middle ear or other things. Should we do more education and aware workers that they are exposed to this hazard every day in and out, and if they have predisposing conditions, they are more at risk or more prone to this type of injury. Can there be administrative controls? Can we employ more workers for the same job? Can we, because this worker was doing this job only night shift, so maybe this type of work could have been spread on 3 different shifts to reduce the exposure. These are the things which needs to be validated and researched. So I hope you have questions, because there are a lot of unanswered questions in this.
Just in regards to your comments about it not being prevalent in mining, I have to disagree. I've seen at least 3 cases like this where I'm allowed to operate, and it's about people who have things like a head cold, ear infection, you can't release the pressure halfway down the shaft because you can't pull the brake. So by the time you hit 3,000 feet, it's too late. That happens a fair bit, but you wouldn't see that because those are just, they're allowed. It's so obvious they're allowed without question.
And I think they are also a little unrecognized, because miners think that this is part of job, and because ruptures can also heal themselves.
This is true. And you just have a head cold and hit 3,000 feet and not come back up because you're about ready to pass out.
So there you go. So this is something which is, according to you, prevalent, and we have good number of population employed in mining industry up north. So this is something we should be looked at.
Because I've been one of those that had to come back up before it.